Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Tuesday, April 28th. Here we are for our COVID-19 local information program. Welcome back.
Welcome back. Yeah.
Welcome back, listeners, viewers.
That's right. Viewers, listeners.
Good to have everybody along with us as we share local information
about
the coronavirus.
That's right.
And what we're
COVID-19, SARS-CoV-2, all of that.
All the above.
All
I'm
the
afraid.
above.
Yeah, that's
I'm
what we're
afraid,
calling
yeah,
it
exactly.
these days. But yeah.
Yeah.
So we have a guest right away.
All right, let's do it.
Right. So we could check and see. You seem to know who this is already.
Let's see.
Good morning. You're on KSJE.
Hey, good morning.
Hello.
This is Chaplain Todd over here at the hospital.
There he is. You were right. Megan was right.
I was right.
She could tell by the way the phone rang that it was you, Chaplain.
By the blink on the hold signal.
How about that?
I was sending vibes.
There you go.
That's right. Good morning. So, Todd, a lot of folks don't know what chaplains do, and they might not know exactly what chaplains do at a hospital. Can you give us a rundown on what you do over there?
Sure. Let me see if I can do that. Wow. Where do I begin? Obviously, we are available to visit patients. Maybe patients who are requesting to be visited by a chaplain or somebody. Maybe not. Sometimes I just randomly call on patients and kind of check in and see how things are going. And what I'm looking for primarily is something that we call spiritual distress. Spiritual distress is kind of the opposite, I guess you might say, of a working definition of spirituality, which talks about the way individuals express meaning and the way they connect to others and even themselves or the sacred, and sort of the purposes that they feel in life. So, I mean, if you just think about, anybody, what are the things that are most important to them, whether they are able necessarily to articulate all those exactly or not. It might be their family. It might be their faith. It might be, it might be spending time in nature. But if a person is in the hospital, they're sick, or a loved one is in the hospital and injured, they may be experiencing kind of a disconnect. They may be beginning to wonder, gosh, I always believed this about the universe. How could this have happened to me? How could this have happened to my loved one? So a lot of times people kind of lose sight of the resources that they already have available to them, either internally or from their past. Maybe physical, tangible resources around them, be they people or a pastor or whatever. And so a lot of times what my role is to help them kind of identify and recognize those and begin to draw on those in a different way. So that's part of it with patients. Of course, a lot of what I do is spending time with our staff. And that's especially critical right now, I think, because of the restrictions on who I can visit, who I can't. The social distancing and the precautions, because really I'm not going into any of the rooms that are occupied by patients who either are positive or suspected of having the COVID virus. I don't go in those rooms. So my task really is to monitor the staff and make sure that they're not coming off the rails or whatever. So those are just a few of the things that I do. Yeah.
Great. Yes, that's wonderful. That's wonderful. So yeah, that touches the COVID not visiting touches upon concern or a question about do you connect by phone? How do you comfort family members and friends who might also be barred from visiting their loved one who has COVID? What happens when the patient succumbs to death? How does that work? So can you go a little more into that as well?
Yeah, and obviously that's kind of where the rubber meets the road today. So, and that has been a challenge, and like so many people have said, and I've said and felt, I'm just kind of making this up as I go because there's not a playbook for this. I certainly wasn't, we weren't instructed on this kind of a situation in my training. So this is a whole new thing. But Yeah, I mean, in fact, when we're done here, I have to. There's a patient I need to call who has specifically asked and is pretty anxious to spend time talking to me. So, but I can't go in her room. She's a COVID positive patient. So I will get on the phone and call her, and we'll spend some time talking. I've done that with a number of patients. It doesn't always work because, well, either the phone isn't next to them, or maybe the phone's unplugged in the room, or maybe the phone isn't working properly, and so I have to spend some time trying to network with the nurses, and so sometimes that adds an extra burden on them to have to carry a message in and make sure all that stuff is in order. So sometimes I just kind of, I'm just hoping that I connect with somebody, and honestly, I haven't gotten that many referrals during this time frame. I just haven't. Partly, I think, because there's just a different mindset, and nurses know that I'm not going to be going into those rooms typically, and maybe they're not even asking the same questions of patients when they come in, like, do you want to see a chaplain, or do you want to visit, or whatever. So there's a number of, sort of mitigating circumstances around that. Occasionally, I'm called in to help support a family maybe that is downstairs. Maybe they're downstairs at the front desk and they're not being allowed to come up. And they're pretty anxious. And I'll go down and I'll sit with them, I'll spend time with them and maybe brainstorm and come up with a resolution. Either with using their iPhone and doing a FaceTime meeting with them. We do have some technology available to us up on the floors if patients and families can make that happen, and nurses are certainly there to help make that happen. The other day, somebody called me. Somebody called me and they were upset because they weren't getting any information about their mom who was upstairs, and she's not a COVID patient, but she was upstairs and they couldn't see her, and they were anxious. And so I said, well, let me go see what I can do. So I went to visit her. Prayed with her. She's a really sweet lady, and I got on my phone and I called this guy back and we FaceTimed, and he was able to see his mom, and his response was, that was all I needed, just to lay eyes on her. And that, what do they say, a picture is worth 1,000 words. Well, I guess the FaceTime is worth 1,000 words as well. So we do what we can, and as I said, I'm really just kind of figuring this thing out as I go, and I'm beginning to realize as I go along, wow, there are some things maybe I should have been doing that it didn't even occur to me. For example, I mean, typically, it doesn't always happen, but typically I'm supposed to be notified whenever there's a death on the floor, or if a patient is placed on comfort measures. The family and the patient has decided that maybe we've tried everything we can, so let's just make them comfortable now and let the process take place naturally. And it hasn't really occurred to me that I haven't been getting notified. I haven't been getting calls. I've been so focused on spending time with the staff and being available to them that this part of it never occurred to me. And so I was actually talking to somebody in ICU this morning about that, to say, hey, you guys have kind of forgotten about me. And certainly I recognize there are limits to what I can do in terms of the patient and the families. But certainly, again, the staff. I'd like to be there to support the staff. So those are just some kind of off the top of my head thoughts. Maybe.
Yeah, very good, Todd. And I wanted to ask you, too, about visiting with some of these patients who may be kind of onto that just being comfortable type of care and that hospice type situation, and what your message is to them and those families maybe when the outcome isn't so positive, and even with some of this COVID-19 cases that are coming in, and I imagine folks are pretty worried if they're diagnosed with this. Many recover, but unfortunately many do not. Is that something that you are dealing with as well when you're on the floor?
Somewhat. I think the first couple of weeks of this, at least here at our hospital and for our staff, I think it was more challenging and maybe more emotionally difficult in the early days because we were new at this. And honestly, I think maybe I can't say for sure, and I haven't really looked at the numbers, but in talking with some staff. I think maybe we had some more deaths early on. I think maybe there were some things we were learning as we went along. And I think we're improving in the way that we're providing care for patients. I think we're learning a lot, and patients are faring a little bit better right now. And the staff is handling that better. They're feeling a little better, a little lighter about their role and their jobs right now. So that's definitely a positive. For those folks, Scott, you were asking specifically maybe about folks who, as I said, are placed on comfort care. Often, to be honest with you, often that takes place at a point in time when the patient is maybe almost no longer responsive. They're slipping into a coma, or maybe they're just sleeping most of the day. And so I don't often have a lot of interaction with the patient around that. I do occasionally, and those are some pretty interesting conversations. But with families, I just really, I encourage them to try to talk and to tell stories, and to remember that if they're in the room, this patient I just operate on the assumption that they're hearing me. And so let's not talk about them like they're not here. Just include them in the conversations. Mm-hmm. And then I would say finally, in that context, I often, depending on kind of the mood and the tenor of what's going on in the room, I will sometimes pull families a little closer to the bed, because a lot of times people are scared to be in those rooms and to watch someone as they are taking their last breaths. But I will encourage people to come closer. And I will say, I know this is sad, and I know this is hard, and this hurts, and it will for a long time. But I also don't want you to miss something that we're witnessing here that is actually a mystery, and kind of a mystery of wonder. Medicine and our science is remarkable, what we're able to do and have learned, and will continue to grow and develop. But this transition, this process, is something we truly don't understand and don't know what it's like. It's a mystery, and I think it's supposed to be. I think it always will be, and I think there is a wonder and a beauty to that that I want families to kind of acknowledge and recognize.
Yeah, I agree. And any of the rooms I've been in when death is approaching, it really does have this strange, mysterious, ethereal thing going on. So
there is a kind of holy and sacred air about
yes.
the whole experience. And I don't mean to paint a rosy picture, because sometimes it's gross and ugly and it's nasty and it's hard work.
That's right.
And
That's right.
all kinds of. But it is what it is. So I sometimes really work hard to help families acknowledge that, but also just to tell stories and to begin that process of letting go.
That's right.
But how reassuring that you're there to help these families through at that time, no matter what is going on. And I think that's helpful. And for the staff too, Todd Smith, I think, again, kudos to you for the work that you are doing at our hospital. Thank you.
Well, yeah, thank you, Scott. I appreciate it. It's not real fancy or glamorous what I'm doing, just kind of, I'm rounding on the staff throughout the day. But a good friend of mine at Memorial Hermann Hospital in Houston, he said, seems like empathic listening and maybe every now and then sharing a candy bar with somebody, those seem to be the most effective interventions with our staff. And he said, people will remember that you were there for them when the going got tough. Mm-hmm. And I hope that's the case. I hope it has meaning for people that I am there. And in some ways, I think, from what I'm hearing and reading, I think, in some ways, staff are going to need me and others more mm-hmm. when we get to the other side. I think,
right.
When the pressure begins to release, there's going to be some residual emotional trauma, if you will, that maybe need to be dealt with. Mm-hmm. So hopefully they'll remember that I was there.
They will. I'm confident. You can say hopefully, but I'm 100% confident that they will and that you're doing good work there. So thanks for calling in, Todd, and giving us an insider's view of this. Again, I don't think folks generally know what chaplains are up to, and so it's great to have you on the air with us. Thank you.
It's pretty heady stuff at times, but thank you, Megan and Scott. I really appreciate you guys and the chance to talk to you. Great.
Well, thank you very much. Todd Smith, chaplain from San Juan Regional Medical Center, calling in to our COVID-19 local information program. And again, that spiritual health has got to be an important part of physical health.
I hope so.
Right?
Right?
For some people.
Yeah. Well, and I think, as Todd said, spirituality is such a broad
Sure.
understanding, and so everybody's got some sort of piece of themselves that would fall under that category, and it's really just any transcendent concept, love and connection and meaning and all of that, and every human being searches for that, and so it doesn't have to be housed in any sort of specific structure or religious paradigm. So it is interesting work, and I've appreciated it when I've engaged in it in the past, and so it's great that we have somebody over there that's reliable and doing the work. So.
Right. Well, and again, there are other chaplains in other capacities at other facilities throughout the county, and so kudos to all of them and the work that they do during this time. So thank you, Todd, again for calling in. We're going to change gears just a little bit, though, because our next guest is from the city of Farmington. Warren Unsicker is on the line. He is the Economic Development Director with the city of Farmington. Warren Unsicker, good morning.
Good morning. How are you all today?
Good, thank you. Thank you for calling in. And there's an event coming up this Thursday that is for local businesses. Warren, can you talk to us a little bit about this event? And I assume it's somewhat related to the COVID-19 because of the restrictions on these businesses. Is that a stretch, or is that true?
Well, to a degree, and a lot of what we're trying to do is that the community knows the vehement efforts that are being undertaken by the elected officials and community partners to try and make sure that businesses and citizens are being taken care of throughout this unprecedented time. So it's a great opportunity to hear from our leadership as well as ask questions of them as we go through this process together.
Very good. And so walk us through. This is going to be kind of you're not gathering any place, right? This is kind of a Facebook Live event, right?
I like to call it a virtual town hall, so to speak. Yeah, so this is will be hosted on Facebook on the City of Farmington's Facebook page. So City of Farmington NM is the tag for Facebook. And so this will be something that can be viewed live this Thursday at 4 p.m. We will, of course, record it, so if you aren't able to make it at that exact time, you will be able to follow up. And you'll be able to ask questions via Facebook that we'll be monitoring through the process and raise questions to our speakers at that time. So,
understood. And who are your speakers going to be? Who have you invited?
We've got the Mayor of Farmington, Nate Duckett. We have County Commission Chair, and we likewise have, Jack Fortner. We likewise have College President Tony Pendergrass, as well as the Chairman of the Board of ForSed, John Byram, who's also works at the PESCO.
Yeah, that's a wonderful panel. So, Warren, what is the outcome that you guys are hoping for? Like, what am I going to get out of this once this is all said and done?
Well, this particular meeting, again, is to really share information about what's being done, somewhat not behind the scenes per se, but by leadership to help work with the state, work with the feds, work with key partners in the community to assist with businesses. We have what we're calling a business response team that helped put this event together that's made up of the chambers, the CVB, the resource partners at the college itself, the city, Farmington, the county, all these groups that have come together and banded together to try and disseminate information and make sure that businesses know what resources are available to them through this process. And we coordinate with the state economic development group as well as other entities at the state level and monitor federal level programs through the SBA and other entities to make sure that that information is getting out to the public. And we post that not only through our Facebook presences, through the city and other entities, but also on our website. The college and the city both have some very robust web presence with information about what's going on right now.
Gotcha. And Warren, yesterday I spoke with Carmen Martinez from the Small Business Development Center, and of course she was talking about that some of these federal programs that are available, it's kind of time is of the essence type of a thing, and businesses kind of have to be nimble to be able to apply or get through to their bankers to get some of this assistance. Is that some of the information you'll be sharing as well on Thursday?
Yes, on a much higher level, and this is something we did have a previous webinar similar to this that was laser focused on the Paycheck Protection Program and what went into that, and I believe we have recordings of that as well. But that one was specifically because of the timeliness of getting those applications in. We wanted to hold that before the time passed, essentially. So this is a much more higher level and opportunity to really hear from the leadership throughout the community and what's going on there. So, and again, the Paycheck Protection Program, the EIDL loan, and now a new one that is a way for businesses to actually get assistance with getting their unemployment if they're a sole proprietor, that the SBA has rolled out, is coming soon. Actually just launched earlier this week. And so that's new information that we've been getting out there and trying to make sure that people are aware of, because, again, it's ever evolving and something that you have to really keep on top of. And so we're doing our utmost to try and share that information and try and get it out to the people. So it's the Pandemic Unemployment Assistance, or PUA, and it's specifically for those that haven't been paying into unemployment insurance because they pay themselves. And so this is an opportunity for them to apply for assistance.
Okay, interesting. And that is that the one that you apply for through the state to
No,
access?
this is a
Federal.
an SBA program.
Okay.
This is a federal program.
Gotcha. And so will there be some conversations, too, on Thursday, Warren Unsicker, about what the future will look like, the reopening of some of these smaller businesses that have had to close during some of the governor's orders, or is that a different conversation?
That's probably a different conversation, and one that's ever evolving as well, as you've probably well seen from the state level as well as from a local level. And so, and that's a part of the equation that's ever evolving as well, and we're closely monitoring our neighbor states as well to see how that's going to impact our community. So, again, these are things that are being closely tracked and monitored, and we're trying to keep on top of those as well and make sure that we are reacting as quickly as possible and taking advantage of any opportunities that arise.
Okay, very good. And so, again, the event is kind of an online town hall on the City of Farmington's Facebook page. It'll be a Facebook Live presentation this Thursday beginning at 4 p.m., and folks can ask questions then through the Facebook Live video, almost like we do here at KSJE.
Absolutely.
All right. Very good. Warren, thank you for calling in this morning.
Thank you very much. I appreciate the opportunity.
You bet. Good to talk to you. That's Warren Unsicker, the Economic Development Director with the City of Farmington, our guests here on KSJE on our COVID-19 local information program. Small businesses, I mean, we know how important they are, and and so any information that we can get out to help them get through this time is important.
Yeah, and to have it all in one place.
Right.
Like that's wonderful,
Yeah.
right?
Well, and to have folks available
on.
to answer your questions.
That's right.
Like you said, the panel is a
powerhouse
Think
panel.
of the brain power in that room.
That's
if they were in a room, there'd be a lot of brain power in that
right.
room.
Virtually together,
Yes.
still a lot of brain power.
Cyber room.
Cyber room.
There you
I
go.
like that.
How
Like
about
physically distances
Right.
and in the cyber room.
Exactly.
Yeah. I saw a
Exactly.
great tweet this past week where it talked about, can we talk about the linguistic change of saying I'm on a meeting
That's
versus
right.
I'm in a meeting?
Yeah. How about that?
New cultural shifts.
A little bit.
Right
That's
and
true.
left, all over the place.
That's right. Very true.
Yeah.
Interesting. Well, we will open up the phone lines.
Yes.
If anybody else would like to call in and chat, let us know what you're doing. We haven't gotten a lot of folks that have called in. We got a lot of folks that are watching us.
Yeah.
Which is great. We appreciate that.
Yes.
Hi, everybody. But we do have a lot of folks that call in to share with maybe what they're doing these days.
Or questions.
Right.
Ask us anything. Almost.
Really? You really want to go there?
I do,
Okay.
actually.
All right.
Well, because we could still just mute them. We could.
Yes.
If it gets too
True.
personal, we could just be like, bloop.
That's true.
Done. Yeah.
Exactly.
So, I thought maybe that would help butter them up and get them excited.
Maybe.
Ask us anything.
It could. Okay.
But it doesn't seem to,
Right.
Now I'm just feeling a little rejected over here.
I'm
in my
sorry.
seat.
Well, then let me call. There's a little delay. We know that. So
There's a delay.
we'll give a few seconds to do that. I'm going to look up some numbers
Yes,
here
good.
from yesterday while
Great.
you riff on
I
people
was going to
calling.
say, well, people calling in, and also, so the number to call in is 566-3909. But also, check this out. So I was thinking about the curfew, right, that the Navajo Nation is having to implement not just every weekend, but now more than every weekend. And so I looked up the etymology of curfew, the word because that's how I roll.
No, because that's what you do when you have time on your hands.
It's a late night time on my
we've
hands.
met you, so okay.
Yeah, right? There's always an etymology lesson every week. So it comes from a French phrase, which I'm not going to even try to pronounce because I don't want to offend our French listeners.
We have so many.
We have so many.
That's right.
Okay. But it means cover the fire. And it was used to describe the time of blowing out all the lamps and candles. And then it was later adopted into Middle English. Again, not going to try to pronounce it. And we definitely have 0 Middle English speakers. I just don't want to embarrass myself. And that became the modern curfew. And then in early America, the American colonies, they would use it. They would agree at a set upon time, this is where we snuff out the fires.
Everybody stay home. Or
Right.
go home.
I mean, this is like,
Right.
this is
Sure.
like a throwback social distancing concept.
Right.
We're all agreed here. You snuff out the fire at this time, and so that relates to like they would use these clay pots, and they would call the pots curfew.
Really? Well, thank you.
So
for
it's
that.
a universal agreed upon time to end the activity.
I gotcha.
I know.
Interesting.
They called the pots curfew.
Okay.
So there you go. You're welcome.
It makes sense in a weird way.
It's really. So I'm a words nerd. So
Yeah. Okay.
Cool.
Well, thanks for sharing that.
Yeah.
That's
Cool.
interesting. So there you
Thanks.
are, and here we are again.
Yeah.
With curfews. So
Yeah, exactly. So there you go. It's
everything
relevant
old
this
is
time.
new
That's
again.
good.
Here we go.
Everything old is new again.
That's right.
Time is a flat circle. Okay.
So again, if we go to our the KSJE website, which is where we've tried to compile some of the local stories
Yes.
about all this and what's been going on. I'm going to take the crawl off for just a moment here, but we had 101 cases in New Mexico. Now, if you remember the numbers from Sunday, they were somewhat delayed,
The
and so
lag,
I think we've
yes.
caught up. And so this
Yes.
may be some numbers from Sunday, some numbers from Monday as well, all added together. But we had 21 new cases in the county, in San Juan County, New Mexico, everyone. 5 deaths across our state in New Mexico. For now, we have over 100. And in San Juan County, there were 2 of those 5 were here. We now have 16 more recoveries.
Okay.
So, in the state as well. So again, there is that information. Other stories, again, ksje.com/news. Navajo Nation from over the weekend. They didn't put out anything, I don't believe, on Sunday, but these are numbers from Monday. They were up 53 cases with no new deaths from the Navajo Nation, which is
That's great.
somewhat significant. If we could keep that going, that would be good.
That'd be wonderful.
I would think.
Yeah.
So yeah, La Plata County had 6 new cases. That's in the last about 6 days since that number was updated. So there is that as well.
Yeah. So and again, we keep saying it's so important that to recognize that the more testing we have available now, because thankfully
Right.
we have more available now. The numbers, we should see the numbers actually spike, which could be alarming, but it's because we're testing more. So I guess remains to be seen. Who knows? I mean, I think it's like, again, and everybody's singing the same tune about how much we know and how much we don't know. But that seems to be an important thing to point out over and over again. The more testing you're going to get, the more positives you're going to get for some time. And then maybe we'll see this peak, but we're certainly not there yet, I think is what the experts are telling us.
Exactly. I think that's true. Thank you for that. Well,
You're
I think
welcome.
we're a couple days behind from a lot of the tests that were done
Yes.
Sunday and Monday.
Right.
We're going to probably see that hit with the numbers in
Right.
later on this week, perhaps.
Perhaps.
So we'll be monitoring. That's why we check those every day.
Yeah, and
So
it was
we'll like to look at that.
456 tests were done on Sunday, and we can assume maybe similar Monday. They
As-
had 1,000 tests available.
That's right. So we
the
hope that
county
they
told
tested
us.
everybody. I mean, they used all the 1,000 tests. Let's hope they did.
But I'm sure, yeah.
That would be great. So,
Yeah.
I wanted to go back to this
Yes.
site from the New York
Yes.
Times that we shared yesterday on the show because I thought it was interesting to share it. And again, it's the New York Times, and I think they have very credible information. So they've done
Usually, yeah.
all
I
the
hope so.
legwork
Yep.
of compiling this data. But we don't always see Farmington compared to larger places.
No.
Usually you see the major cities and how they're dealing with this, and the smaller towns really don't get a lot of the national spotlight
No,
of coverage
yeah.
unless there's a gigantic
Disaster,
spread or
one might
disaster
say.
or whatever, and we've gotten our share of that attention too here.
Yes.
But I want to show again, and we put this link on yesterday's program, and we'll put it on again today, because you can type in Farmington, New Mexico, and it actually knows that Farmington, New Mexico exists and has data for Farmington, New Mexico,
Yeah.
and plots it.
What a way to be put on the map,
Right,
so to speak.
in
yeah.
in these graphs. And so if we look at this, where the outbreak is the worst now, and you can see the places in Ohio, but number 4 is Gallup, New Mexico, which again, a smaller community.
Yes.
But they are doing the per capita numbers to compare it with the larger areas. So they're above New York City.
Right.
Just ahead
As
of New
far
York
as-
City where it's worse.
Right. As far as the per capita thing goes.
Yeah.
Right.
Exactly.
I know, it's distressing. 7.97 humans per every 1,000. I've always
Right.
wondered how that works, because how do you have a 0.9 human?
Right. It's math.
Right. So now we're not surprised that I don't get it.
But my
Yeah.
point is,
Right.
since I put in Farmington, New Mexico, if I scroll down on this list, it shows us where Farmington plots on this number.
Exactly,
Right?
yeah.
So Gallup's number 4.
And New York City's
Farmington
5,
is
yeah.
32nd.
Okay.
So we're not at the very bottom of the list, but we're not at the very top
It
of the
says
list
that we're
either.
flattening. You see that?
I see that, which is good news.
That's
It'd be
great
great,
news.
right? So we'll fingers crossed.
But then,
that's
why?
happening.
Okay, so on the left side it says we're flattening. Now go to the right side. It says
This is new deaths.
New deaths,
And the
okay,
deaths
so
are still
still
growing,
growing,
and
okay.
Farmington's ranked number 12
Right.
out of all of the metropolitan and micropolitan areas around the country.
micropolitan.
Yeah. But again, interesting to see us ranked
Yes.
with everybody. And that's why I
Yeah.
liked this website, and that's why I'm sharing it yet again, everyone. One more. Where outbreaks may come next. So again, we see Sioux City, Iowa. If we look, Gallup, New Mexico is number 9. Farmington is 25. So
Okay.
lower on that list.
Good.
And again, the highest average daily growth rates of deaths, we are number 4 on that chart.
Right.
All right. And then if we look going down, if we want to talk about good news, which we love talking about good news.
Oh, good news is good.
We love good news, right?
do.
So where there may be good news
Where are
ahead,
we?
right? Where new cases are decreasing the most.
Okay. Are we
Albany,
on that
Georgia,
list?
New Orleans, New
Sure.
York City, and Farmington. So we look at, we're number 304. That's not
I
good.
thought, I was going to say, I thought we were going with the good
Well,
news.
that's where we're
Scott.
plotted on the good news chart. So we need to do a little better job of
We
staying
do.
home and not,
I like this.
flattening the curve.
I'm plotted on the good news chart at 304.
I'd like to see it higher.
I would
I'm not
too.
lying, but this
would
is
too.
the data.
This is the right.
This is what we're looking at.
what can
okay.
we do? Data is data.
And on the right hand side, where deaths are decreasing most, again, and we're still seeing, unfortunately, people dying in our state, in our
course.
county.
Yep.
And so again, Albany, Georgia, New York City, and again, they're kind of ahead of us for cases. We're at 129 for Farmington. So that's where we plot on that chart.
On the death chart.
And we'd like to see that go higher.
We would.
So maybe we'll keep checking back on that. Not every
We
day,
should.
but from time to time,
Yeah.
and see how we're doing.
Yes.
So-
I think that's a good idea.
I don't want to bum everybody out, but that's where we are.
Well, it's just the facts of the facts, man.
And we're in this together.
We are in
and
this
that's
together.
how it is, right? We're a community, and the community is banding together.
apart.
Yes, true.
Right.
We are physical distancing.
But we are together. In
We
it
are
together.
together.
That's right.
That's true.
That's right.
So anyway, all right. If you folks want to call in and share again with what you're doing, 566-3909 is the number. 566-3909. You can give us a call and tell us how you are going through this self-quarantine, this kind of staying at home order, things like that. I've been trying to just go to the store once a week, and I should probably try to do that only once every 2 weeks.
That
Hasn't worked for me yet.
Well, it hasn't worked for me yet either, because my refrigerator is like on the smaller side. I mean, it's not like dorm office refrigerator size.
Okay.
But it's certainly not the those people that
Giant.
have the fancy double doors
Right,
with
like,
the
yeah.
really. I bet you have a fancy double door refrigerator, don't you?
I don't know what that means.
Like where you can open two sides.
Okay,
As
yes, I
opposed-
guess I do.
Okay,
I
there
guess
you
I have
go, see?
a fridge and a freezer.
It doesn't your Internet of Things, your IoT, isn't your fridge included in that? You have one
No,
of
I
those
do
fancy.
not. My fridge is not smart. It's a
Okay.
dumb fridge.
Yeah, my fridge is a dumb fridge as well.
Okay.
And,
Well, there you go.
And
but apparently
yeah,
small.
It is small.
So you're going every week.
right.
I gotcha.
That's where I was going.
Okay.
Right.
All right. Interesting.
Yeah.
I'll share a couple things that we had from my conversation earlier at 8 o'clock with Dr.
Great.
Kim Mizell from Bloomfield Schools. They were talking about, again, graduations.
Mm-hmm.
And in Bloomfield, graduations have been postponed, but she said on the program that as soon as the restrictions are lifted, Bloomfield is hoping to do some sort of ceremony for their seniors. And so she's advising everyone to kind of stay tuned. And then she also mentioned that they are working now for the fall, right? Because you got to start thinking about
You do.
when school starts up in August, what that's
What's
going to
that's
look
going to
like.
look like? That's right, because we're not going to have a vaccine by then. And
Doesn't seem like it.
it
so,
would be a pretty miraculous thing, I think, if we did.
right.
But
And so do you bring students back? Do you
hope
leave it
so.
online? Do you have bricks and mortar classrooms again? And so they are coming up with different scenarios to whether it's an all online situation as it is right now, if it is coming back to the classroom and they are looking at maybe buying masks for every student, every faculty, every teacher, everybody.
I mean, high school's hard enough without having to wear a mask everywhere, right?
Well, they're going to be cool. They're going to be Bobcat masks for Bloomfield, so I like that.
They're hot, though.
Yeah, that's true. And they're thinking about maybe ways to scan temperatures of everybody
Yeah.
coming into the building,
Right?
and some of that new
Which could be
normal,
good.
which is what we may see. So those are the conversations. They haven't
Yeah.
kind of made
I
any
mean,
decisions.
in all fairness, right? Like scanning temperature when you go into big public spaces, like maybe not a bad idea. Like,
We may be seeing
Yeah,
that even at restaurants if we're able to go out
yeah.
at a lower capacity in a restaurant to sit
Yeah.
with friends. We may have to get our temperature taken.
Right. Well, and certainly bugs rip through schools all the time. I mean, not to this level, obviously,
You
but
mean colds and flu and viruses, not actual bugs?
bugs.
Just to be
I
clear.
mean,
Just to be clear.
Were people confused on that? Maybe.
I was,
Okay,
for a
fine.
moment.
Like, like a regular flu season or something,
Yeah,
right? They're
right.
always coursing through schools.
That's right.
And so, if you get some fancy temperature technology, hopefully once we pass this current crisis, like, it's still a valuable piece of technology
That's
to
right.
have.
Right.
I'll tell you what, though, teenage Megan, if I had to wear a mask to school, I would constantly be thinking about how it would cause me to break out.
Aha.
Yeah,
Well, there's
right?
that. Right.
Teenage acne, man.
That's true. That's a
rough.
legitimate thing.
It's
so
a legitimate
there,
thing.
there you are.
But still,
And is
better
that-
than the COVID.
I suppose that's true. That's true. And Dr. Mizell was saying, what if you have you kids coming back to school, but maybe there's a kid who does have tested positive.
Of course.
So they can't come to school.
Right.
So they've got to stay at home, but still get their lessons.
Well, and
until
that's a
they're
great point
better.
too. Online learning is a technology that can stick for some time. If you miss a couple days because you were sick.
Right. Or
I mean,
a couple weeks.
or a
if you have
couple
to
weeks,
self-quarantine,
depending.
right? I mean, that's
Right.
kind of where we are. So anyways, there's some of that being, at least in Bloomfield, the conversations. Now we're going to be talking with, I'm talking to Dr. Schmidt from Farmington Schools tomorrow morning at 8, everybody. Feel free to tune in. We may get him to stay late and talk about
would be awesome.
that on our show
That'd be
tomorrow
great.
at 9. So that'll be a request I'll make to Dr. Schmidt today.
Great.
And
He'll be in a cyber room.
He will be.
Okay.
He'll be zooming in.
Zooming in.
That's right. He'll be on a meeting with
On
us.
a meeting.
With us.
Not in a meeting.
No.
On one.
That's how we do it now. That's right. So there you go.
Yeah.
All right. Well, nobody has called. I guess we're doing okay. Or they're too polite
Well, I was
to
going to say,
call.
yeah, because normally I'm like, ooh, somebody feels like they need to rescue us. Look, there's a caller on the phone.
Yeah, no,
But
they don't.
Cool.
I guess we're doing all right.
I guess we're okay today.
But anyway, we will wrap it up today, everyone, but we'll be back tomorrow. Again, our hope is to talk to Dr. Schmidt with Farmington Schools, again, to see kind of some of the things that they're talking about in regards to COVID-19. And, of course, we'll have much more coming up. Our plans for Thursday are to talk to some emergency infectious disease doctors from the hospital. So we're looking forward to that
Yes.
just because they have a lot of frontline information.
Expert
for us.
information, yeah.
So we appreciate
The
that. That's for
best.
Thursday's show.
They're so good.
Again, a shout out to our partners over at KNMI. You can hear this program at noon, Monday through Thursday at KNMI Vertical Radio, 88.9 on KSJE, 90.9 FM every afternoon at 5:06 p.m. I'm Scott Micklin.
And I'm Megan Culp.
We will see you tomorrow at 9, everyone. Stay safe.